Hello, thank you for joining us. We would like to start with a short poem written from the perspective of a patient suffering from depression.
It's dark. We wander. Our vision is clear. We isolate from those most dear. The darkest days are the ones that stay, and yet everyone around seems okay.
Depression and anxiety can lead patients to the darkest of places, but talking therapies can often be the light at the end of the tunnel. In the NHS, patients can access talking therapies through IAPT.
In efforts to provide timely care, Nick Clegg established the first ever mental health waiting time targets in 2015, where 75% of patients should start treatment within 6 weeks and 95% within 18 weeks.
Although IAPT has been meeting these targets, half of patients are waiting over a month and 1/6 wait over 3 months for the second appointment. So we wanted to make a real difference for these patients, driving us to explore these waiting times further. We outlined 2 aims for our project: to evaluate IAPT's waiting times and to propose appropriate recommendations for the waiting times. These were the 5 main stages to our project.
In our SLR, we assessed the effect of long waiting times on key performance factors. The 3 main findings were long waiting times cause poorer patient outcomes, there is a bi-directional relationship between long waiting times and poor patient engagement, longer waiting times are associated with increased staff burnout.
We then carried out semi-structured interviews with 10 therapists. Our qualitative data collection facilitated our pragmatic philosophy and inductive approach. We also used Clark and Braun's 6-step model for our thematic analysis. We identified 3 higher themes.
Firstly, waiting times for appointments. Therapists reinforced there are vast disparities amongst IAPT's waiting times, which is rooted in years of underfunding. This is complicated by the increasing need for mental health services being met by a manpower shortage.
Secondly, patient experience. The therapist revealed that patients are not always well supported during these waits and are often unaware of how long these waits can be, and when they finally reach their appointment, their expectations are not being met. Notably, many patients think they're going to receive one-to-one counselling instead of group CBT. These misguided expectations can cause patients to disengage, feeding into IAPT's high DNA rates of 45 to 48% and creating a self-perpetuating cycle.
Thirdly, therapist experience. Many therapists said IAPT's target-driven culture leaves them with immense workloads and a high level of burnout.
Based on the concept of Q psychology, we aligned our main recommendation of an app to 3 points. Pre-process waiting feels longer than in-process waiting. Unoccupied time feels longer than occupied time. And unexplained waits are longer than explained ones.
Our app tackles the problem of waiting times in 2 ways. It supports patients as they wait and could directly shorten waiting times by reducing DNA rates. Although the mental health app market is saturated, we found the need for an app that increases both patient engagement and patients' understanding of their IAPT journey.
So let us talk you through the app. As you can see, our app educates patients to address misconceptions of expecting counselling over CBT. This could prevent disappointment from unmet expectations and subsequent DNAs. Our interviews found 3 main reasons for DNAs. Firstly, patients may forget. IAPT already offers a simple text reminder, but we use staggered and engaging reminders as papers showed this yields better attendance.
Patients also DNA when they're too nervous for their appointment, so we gauge how they feel 2, 5, and 7 days before. The app could put patients at ease by suggesting videos from people who have already been through IAPT, making the videos more relatable.
Finally, patients often DNA due to a fear of the unknown. So we created a therapist introduction screen to put a face to their therapist. To support patients during the wait, our app has a mood tracker, which asks patients how they feel and provides appropriate recommendations based on what they like to do when they feel low. This empowers patients to engage in self-care and better manage their mental health.
Following talks with major stakeholders, ICS Digital, a digital CBT provider, expressed interest in partnering to develop the app, and Manchester CCG were keen to trial it in the future. We hope that in the long run, our app will help shorten waiting times, but in the meantime, we are confident that it can serve as a reliable IAPT companion, making these waits a little bit more bearable. Thank you for listening.